Hey guys, welcome back for another episode of 5 Minute EMS Review. We are in our series on components of an EMS call talking about the secondary assessment. So we have already addressed the secondary assessment of a non-critical medical patient, and today we are moving into the critical medical patient. So let's start off by defining a critical medical patient. A critical medical patient is a patient with a medical complaint that has a threat to any one or more of their ABCs, or they are unresponsive, or they have some other immediate life threat that we are able to identify. So the key with these patients is that often a physical exam is going to be rapidly needed to help us identify what is going on. And a lot of times in our non-critical medical patients, we're able to take a little bit of time to get our history and allow that to help guide us. Whereas in these critical medical patients, we might be having to get hands-on with the patient a little bit quicker. Now, if the problem is known, you might do a focused physical exam. But if the underlying problem is not known, we may have to do a rapid medical exam. A rapid medical exam might even start in the primary assessment and kind of bridge into the secondary assessment itself. We often attempt to limit on-scene interventions to those that are needed for managing life threats so that we can initiate prompt transport, and then we can do more interventions and further assessment en route to the hospital in order to save time and get the patient to a higher level of care quickly. If a rapid medical exam is done on the scene, perhaps as part of the primary assessment, bridging into the secondary assessment, we want to make sure to perform a more detailed physical exam later on while en route to the hospital if time and resources permit. These patients need to be reassessed every 5 minutes, if not sooner. And it's still important for us to try to get a history of present illness for these patients, as well as a past medical history using sample. We may be able to get these from the patient themselves, but if they are unresponsive or altered, we might have to look to family or other bystanders. So it's important to work well together as a team and make sure that somebody is able to gather that information on the scene, even as other critical steps are being done to manage the patient. So that is a brief rundown of the secondary assessment for a critical medical patient. Tune in next time with us as we're getting to dive into trauma patients. Thanks for joining us. I hope you'll share with other people who are interested in EMS and learning, and we'll see you on the next one.